So basically, beneficent and non-beneficent became increasingly accepted as the fundamental principle of morally sound medical device. So even today, the provision of benefits and the avoidance of doing harm are stressed just as much in virtually all contemporary Western codes of conduct for health professional as they were in the oaths and codes that guided the healthcare providers of past centuries. And traditionally, the ethics of medical care has given greater prominence to non-beneficent than to beneficent. And priority was grounded in the fact that historically medicine's capacity to do harm far exceeded its capacity to protect and restore health. So that by having the beneficent and non-beneficents, we need to balance between the two of these situation, which is beneficent and non-beneficent. So that whatever decision that we made is based on the uh, principle of beneficent and non-beneficent. So we need to carefully analyze the benefits and also the disadvantages on whatever decision that we make. All right, now we move to the last topics for the chapter 4, which is good clinical practice or GCP. So basically, GCP is critically important in medical research and healthcare because it ensures that clinical trials and medical studies are conducted ethically, safely, and reliably. So that for the entire life cycle of a medical device, and from the beginning until the end must be conducted ethically, safely, and reliably to ensure the safety to the designers, the safety to the patient, the safety to the doctors, the safety to the technician, eh, starting from the very beginning until the end, which is the management of the risk of that medical device. All right. So basically, clinical research is necessary to establish the safety and effectiveness of health and medical products and practice. So much of what is known today about the safety and efficiency of specific products and treatments has come from randomized controlled clinical trials that are designed to answer the important scientific and healthcare questions. So randomized controlled trials form the foundation for evidence-based medicine, but such research can be relied upon only if it is conducted according to principles and standards collectively referred to as good clinical practice. So this is very, very important guidelines if you want to develop medical device. So you have to make sure that the activities you conduct is based on the good clinical practice requirements. So basically, ECP is an international ethical and scientific quality standard for designing, conducting, recording, and reporting trials that involve the participation of human subject. So compliance with this standard provide public's assurance that rights, safety, and well-being of trial subject are protected, consistent with the principle they have their own origin in the Declaration of Helsinki, and that the clinical trial data are available. So this is very important. All right. So basically, the main goal for guidelines for good clinical practice consists of 7 elements. The first one is the adherence of the trial ethics and GCP to the Helsinki Declarations. So then number 2, analysis of risks and benefits. Number 3, guidelines for good clinical practice, giving utmost importance to the well-being and the safety of the subject or of the subjects. And number 4, the adequacy of available clinical and non-clinical data of an investigational drug for supporting the proposed clinical trial. Number 5, guidelines for good clinical practice require the employment of sound scientific principles. Number 5, no, sorry, number 6, guidelines for good clinical practice require the physician or dentist to take responsibility for medical decision that need to be taken on the subject during the trial. And the last but not least, confidentiality of the subject and the data gathered from them constitute another of the guidelines for good clinical practice. So these seven elements must be fulfilled before during and after eh, any development of a medical device. All right. So these are the good clinical practice concept, which consists of five elements. The first one, conduct clinical trials with an ethical eye, and subject protection is the paramount priority. Have a well-designed plan and stick to it. Select qualified study staff. And the last one, documentation is very, very important. So for every stage of the development, you must document it. Any clinical data, clinical trials, patient data, and so on, so that if there is anything happen, then we can refer to the document as a proof or evidence that the GCP has been done accordingly. Has been done accordingly. All right. So I think that's all uh, for the topics in the chapter 4. And and I think we need to look again, starting from the early topic until the end, so that you can get better understanding on the ethical concept in the development of medical device.